Have you ever noticed that while medical technology is more advanced than ever, the most elite doctors in the world are prescribing fewer pills and more lifestyle medicine? In a world of conflicting health influencers and viral trends, there is a gold standard of advice that lives behind the closed doors of top-tier medical practices. If you want to stop guessing and start following a clinically backed blueprint for your health, please remember to like and subscribe. Let us explore exactly what doctors recommend for a healthy lifestyle and a future of total wellness. 1. The prescription for movement. Doctors no longer view exercise as an optional hobby, but as a primary medical intervention for systemic health. The clinical recommendation is at least 150 minutes of moderate activity per week to maintain a healthy cardiovascular system. Movement helps to regulate your blood pressure and significantly lowers the risk of developing type 2 diabetes today. It is not about training for a marathon, but about consistent daily activity that keeps your joints and heart strong. Physicians emphasize that sitting is the new smoking and encourage movement breaks every single hour. 2. Science-backed sleep architecture. Medical professionals stress that sleep is the period when your brain literally washes itself of metabolic waste. A consistent schedule of 7 to 9 hours is the clinical standard for maintaining cognitive function and emotional health. Doctors recommend a cool, dark environment to support the natural production of melatonin and deep sleep cycles now. Lack of sleep is linked to a weakened immune system and an increased risk of chronic inflammation throughout the body. Prioritizing rest is a medical necessity that allows your tissues to repair and your hormones to stay in perfect balance. 3. The Mediterranean gold standard. When it comes to nutrition, the majority of doctors point to the Mediterranean style of eating as the most researched plan. This approach focuses on healthy fats, lean proteins, and a massive variety of colorful, fiber-rich vegetables. It is clinically proven to support heart health and reduce the risk of cognitive decline as you age over time. Doctors recommend limiting processed sugars and refined grains that cause dangerous spikes in your internal insulin levels. The goal is to provide your body with the raw materials it needs for cellular repair without the burden of synthetic additives. 4. Preventive screening mastery. One of the most important habits doctors recommend is the proactive use of regular screenings and blood work. Detecting potential issues early allows for much more effective and less invasive medical interventions later on. The elite approach to health involves knowing your numbers like cholesterol, blood sugar, and vitamin levels at all times. Preventive care is about staying ahead of the curve rather than waiting for symptoms to appear before taking action now. This data-driven approach allows you to tailor your lifestyle choices to your specific biological needs and risks. 5. The Hydration Foundation. Every doctor will tell you that chronic low-level dehydration is a hidden cause of fatigue and poor concentration today. Water is essential for every chemical reaction in the body, from digestion to the regulation of your body temperature. The medical recommendation is to drink enough fluid so that your system can flush out toxins and keep your cells plump. Proper hydration supports kidney function and helps to maintain the elasticity and the youthfulness of your skin now. Avoid the trap of sugary drinks and rely on pure, clean water as your primary source of daily hydration for all. 6. Stress mitigation as medicine. Modern medicine now recognizes that chronic stress is a physical condition that requires a proactive lifestyle solution. Doctors recommend daily practices like meditation or deep breathing to activate the body's natural relaxation response. Chronic stress keeps your body in a state of high cortisol, which can lead to weight gain and heart problems over time. Managing your mental health is treated with the same level of importance as managing your physical health in 2026. Setting boundaries and making time for leisure are medical must-dos for anyone living a high-performance life today. 7. The muscle mass mandate. Physicians are increasingly recommending resistance training to combat the natural loss of muscle as we get older. Maintaining muscle mass is essential for a healthy metabolism and for protecting your bones from injury and decay. Strength training twice a week is the medical standard for ensuring you stay mobile and independent in your later years. It also improves your body's ability to process glucose, which protects you from metabolic syndrome and obesity now. You do not need to be a bodybuilder, but you do need to challenge your muscles to keep them active and strong. A strong frame is the scaffolding that supports a long life of active movement and physical personal freedom. 8. Alcohol and substance awareness. Doctors recommend a very conservative approach to alcohol and other substances that can tax the liver and brain. While occasional moderation is the standard, many physicians now suggest that less is always better for longevity. Alcohol can disrupt your sleep architecture and lead to increased levels of systemic inflammation within your body now. By limiting toxins, you allow your liver and your kidneys to focus on their natural roles of cleaning your system. The ultra-healthy often choose to live a clean lifestyle to maintain a higher level of mental clarity and focus today. True sophistication is the ability to enjoy life and social settings without the need for chemical enhancements or escapes. 9. Social integration and health. Research has shown that social isolation can be as detrimental to your health as smoking 15 cigarettes a day. Doctors recommend maintaining strong social ties and a sense of community to support your long-term wellness. Meaningful human connection lowers blood pressure and has been linked to a more robust and active immune system. A healthy lifestyle involves nurturing your relationships and finding a sense of belonging in your local area now. The support of friends and family provides a buffer against the stresses of life and improves your emotional health. Investing in your social circle is a medical strategy for a longer, happier, and much more fulfilled existence today. Success is much sweeter when it is shared with a community of people who support your growth and your health. 10. Environmental health awareness. Modern doctors also suggest being mindful of the environment you live in and the toxins you are exposed to daily. This includes choosing clean air, filtered water, and reducing the use of synthetic chemicals in your home and skincare. Your environment plays a massive role in your toxic load, which can affect your energy levels and your hormones. Spending time in nature and ensuring you have good indoor air quality are emerging medical recommendations for all. By creating a clean sanctuary, you are supporting your body's natural ability to stay healthy and vibrant for years. Healthy living is a holistic pursuit that involves taking care of the world around you as well as the world within. The future of medicine is personalized, proactive, and deeply connected to the environment in which we live and breathe. Following what doctors recommend for a healthy lifestyle is about mastering the basics and staying consistent over time. We hope these medical insights have provided you with a clear and actionable path to your best self. Please do not forget to like and subscribe to stay informed on the latest in health, luxury, and high-performance living. Thank you for watching today, and we look forward to seeing you in our next deep dive into the art of living well.